Are you or somebody you love suffering from heartburn? Have you been taking the over-the-counter Protonix or the generic version Pantoprazole for a while, but wonder if you should? Has your doctor recommended that you take it, but you're concerned about possible long-term effects? If so, then this is a video for you. Keep watching to help you understand what you need to know most about taking this medication. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is a channel that focuses on bringing better health to your home. On today's episode, we're going to be going over a common medication that is given for acid reflux named Protonix, or even now more commonly known by its generic name, Pantoprazole. Pantoprazole is a medication that is used to treat problems in the stomach related to too much production of acid. These are conditions such as acid reflux, or the technical term GERD, or gastric esophageal reflux disease. Most people just call it heartburn. But we also use it to treat certain stomach ulcers, a kind of bacterial infection in the stomach, and some rare conditions where there is a significant amount of excessive acid production in the stomach. But most people taking it are just looking for a little relief from that persistent burning in their stomach and chest. Pantoprazole belongs to the group of medications called PPIs, or Proton Pump Inhibitors. There are several medications in this class. Some common ones that you may have heard of are Prilosec, Prevacid, Nexium, or Dexilant, among others. What these medications do is work on the little acid-producing pumps in the stomach to decrease or even stop acid production. Out of all the different kind of acid medications that are out there, Pantoprazole and the other medications in the same class have the benefit of lasting longer. For most people, the effects of this medication will last about 24 hours. Now, the most common condition that we treat with this medication is your typical heartburn, or what we call GERD. GERD is a condition where the acid contents from the stomach will come back up into your esophagus past a protective muscle called the sphincter. The esophagus doesn't have the protective coating that the stomach does, so the acid will irritate and burn the esophagus, causing that all familiar pain that you are dealing with now. So how do you know you're having heartburn? Well, most people with heartburn say that it feels like a burning chest pain, beginning behind your breastbone and moving upward to the neck and throat. Many people say it feels like food is coming back into the mouth, leaving an acid or a bitter taste. The burning pressure or pain from heartburn can last as long as 2 hours, and is often worse after eating, lying down, or bending over. Now, there are other symptoms that aren't quite as common, like nausea or vomiting, tooth decay, bad breath, and even a cough. But I don't recommend that you self-diagnose these symptoms. Talk to your doctor about what you're feeling so you can get an accurate diagnosis, because other things can cause this too. Now, once it's determined that indeed you have acid reflux, there certainly are a lot of options that you have to treat it. But discussing all of those is really out of the scope of what I'm trying to cover here today. Just note that for a good percentage of people, just making some simple diet changes can make a big difference in controlling and even eliminating your symptoms. But even with diet changes, though, we can't always control all of your symptoms. So let's say you talk to your doctor and they're recommending that you take Pantoprazole to treat your heartburn. What should you expect? First of all, Pantoprazole usually comes in a capsule of either 20 or 40 milligrams. The 40 milligram dose is by prescription only, whereas the 20 milligrams you can get over the counter. This medication is designed to be taken on a daily basis. It's not as fast acting as some of your other medications like Tums or Zantac, so if you're only having occasional symptoms, you may do better with one of those. Pantoprazole tends to take a day or two to really start working to its full potential. Now, if you're taking this medication on your own and not under the direction of your doctor, it's recommended that you limit its use to about 2 weeks. The reason for this isn't that you can't take it for longer, but you don't want to be taking it thinking that you're treating acid reflux when something else more concerning is going on. So, it's always a good idea that if you're having persistent abdominal symptoms that you feel might be acid reflux, you should talk to your doctor about it to make sure you know what really is going on. Now, one other really important thing to understand about this medication, we have found that if you're on this for a while and abruptly stop it, you can actually get a rebound production of acid that can make you feel like your symptoms have gotten worse. What I found with my own patients is that they will come into me feeling that they need to stay on this medication because every time they try to stop it, they get really bad acid reflux. The problem is not that they're producing too much acid, but that they stop the medication too quickly. So if you've been on it for more than a couple weeks, you should taper down off of the medication slowly to prevent this from happening. Okay, so now for the question that probably brought you to this video. What kind of side effects can you expect? Well, the most common answer to this question is really not many. Pantoprazole is actually very well tolerated with not very many day-to-day side effects. But as with any medication, if it can have an effect on your body, it can also have a side effect. Some of the more common side effects that we notice from this medication would be things such as headaches, abdominal pain, nausea or vomiting, and sometimes some excessive gas. Now there are some rare side effects that you should be aware of. They're not common, but being aware of them is really valuable. So first of all, just like any medication, you should watch for any kind of allergic reaction. Also, there's a possibility that it can cause a decrease in your kidney or your liver function. It can cause something called pancreatitis, where your pancreas and your abdomen can get inflamed and make you really sick. As well as it can increase your risk of having certain kind of bacterial infection in the colon. There's also some newer concerns about these medications that have come to our attention a little more recently. And we think it has something to do with how these medications work. Remember, proton pump inhibitors like pantoprazole decrease your body's ability to produce acid. Well, one of the things that is needed to absorb certain vitamins and minerals like calcium, vitamin B12, iron, and magnesium is acid. So when you decrease how much acid you have, you can possibly affect how much of these vitamins and minerals are absorbed. We're not exactly sure about the clinical significance of this, however, it's something to be aware of. It's possible that being on these medications long term can put you at risk for low vitamin B and iron levels, as well as increase your risk for getting brittle bones and fractures. Again, we aren't totally sure about whether this actually translates into problems in our own bodies, but it's an important thing to be aware of. One thing that we do know is that they can affect the body's ability to absorb magnesium, increasing your risk of developing a magnesium deficiency. This can have an effect on many parts of your body, including your heart and your nerves. Many now recommend checking magnesium levels for those who are on these types of medications long term. Now, one good thing about pantoprazole is that it doesn't have the same drug interactions as does omeprazole. Omeprazole or Prilosec is probably one of the more common of these medications that are taken, but it has multiple drug interactions that you need to watch for. Pantoprazole luckily doesn't have one of those, so it's a good option for those who may be on other medications. That being said, it's still important to check with your doctor or pharmacist if you're taking other medications to make sure. So what do you do with all this information and how do you decide what to do? The first thing you need to do is really look at making some significant lifestyle changes. Look at your diet, exercise habits, and work on stopping smoking. Watch your portion sizes and when you eat, and pay attention to what foods may make things worse. It may not fix it for everybody, but many times I have seen in my own patients that just by making some simple changes to your diet, living a healthier lifestyle, and losing some weight, they were able to significantly decrease or even stop the amount of medication they had to take. When that is not working, you really need to be talking to your doctor if you feel pantoprazole is something that you may need to be on long term. Talk to them about the likelihood of these long-term side effects and how that compares to the risk of not treating your acid reflux. Because long-term untreated acid reflux not only leads to a poor quality of life, but it can also cause some significant problems, including changes to your esophagus, which can lead to a certain kind of cancer. So as you can see, untreated acid reflux is also dangerous. That's why it's important to not be on long-term treatment for this condition unless it's under the direction of your doctor, so they can monitor for any side effects and help you decide the risks and benefits of each decision. Acid reflux is one of the more common things that we see in the doctor's office. It certainly can make you miserable, but luckily, when diet and lifestyle changes do not work, there is a medication like pantoprazole that can make a significant difference in treating this condition. Well, I hope after watching this, you're a little more informed about a great option for treating this bothersome condition. Pantoprazole is one option that can help, but there are also many different ones out there. I'd like to hear about what you found to be helpful in treating your acid reflux. So comment below so we can all learn. And if you found this information to be helpful, do me a favor, go ahead and hit that like icon and share it with your friends and family. I have a lot of other videos as well on different health topics out there. So if your health is important to you, consider subscribing. Hit that notification button so you don't miss out on any other content. So until next time, this is Family Med with Dr. Richardson. And remember to take care of your body because it's the only one you have.